Welcome to Living Chassidus. Together, let's live the Chassidus we learn.
Welcome, everybody. We are here at Living Chassidus, and we are doing one of our biggest hits as part of Living Chassidus, which is an independent Chabad house, Baruch Hashem, here in Crown Heights. We not only do we help and teach Chassidus, and we encourage women in the women's division. We encourage women to learn and live with Chassidus and take it all the way and not just leave it in Atzilus. But we also like to help with the living aspect. The pillars of Living Chassidus are learning, community, and support, which means we do general classes, we do farbrengens, we do all kinds of whether it's this type of workshop or sit down and learn in the text type of classes. We also do provide a community for single and newly married women here in Crown Heights. And we do so by having social events and celebrating Simchas together, which is very, very special. We also have Shabbatons. And as for the support aspect, Baruch Hashem, I am a Kala teacher, so I'm able to teach Kala classes to all the girls, and I'm also able to, I'm a doula, but that's a different topic. I'm a life coach, and through that, we also have a lot of one-on-one conversations. We help with shidduchim, we help with, if somebody's sick, we have the soup gemach that delivers a beautiful and exciting package when you're not feeling well. And at Living Chassidus, we like to give the full package. So as part of that, we have the life skill series where we teach classes on the topics that women have come and said, I wish somebody would have told me. And at Living Chassidus, we decided we're going to tell you. So we are preparing women with all kinds of topics. If you've seen our latest flyer of our lineup for this winter, we have a very exciting lineup. We have a few weeks ago, or last week, we have the Aviva method. We have pregnancy and postpartum. We have investments, money matters, everything about shaitels, hormonal health, professional success. And tonight we have breathe better and live better. And I want to give a shout out because Henna Shomer is a gem in our community and in the Chabad and Jewish community as a whole, not only for what she's going to speak about tonight, but also for so many other topics of women's health. And hopefully, Henna, you can share more about your other topics as well, Be'ezus Hashem. So I will pass the baton on to her.
Hey, welcome. Do you need to like spotlight me? Okay. Hey, welcome everybody. This is so exciting. I'm so excited to be here. It is such an honor to be part of the work that Living Chassidus does. I am literally just in awe of everything that Michal and her husband and the whole Living Chassidus team does. So it's really such an honor to be here. So I've spoken for Living Chassidus before, so some of you may know me in my role in women's health. I have been working in women's health for over 12 years, mostly teaching online classes to, now I'm mostly teaching online classes to women, restore your core classes and prenatal and birth classes. And my other love, so that's one of my loves. And my other love is what we're going to talk about tonight, which is airway health and oral myofunctional therapy. And really, really, my love is helping people, especially from women, to feel better in their bodies. And so much of the overlap between Restore Your Core and the prenatal exercise, oral myofunctional therapy, is that I feel like there's so many things that we deal with that we just put up with. We think that they're just normal, and we like, oh, this is part of, this is just a package of how I am, however many pregnancies I have, or however many births, or, this is just, and you'll see about the stuff that we talk about with airway health, that this is just, this is just part of it. And when I started learning about airway health and myofunctional therapy, I came into it because of through my children needing help. And I was just really blown away by how many things that I just took for granted as like, oh, this is just normal. Like everybody just deals with this, right? Like it's a rite of passage. Everybody gets braces. That's just normal, right? And then when I started learning that, wait, there's actually like a root cause for these things. And not only is there a root cause, but there's something that we can do about it and we can actually feel better. That was just incredible to me. Learning that, and then, you know, anything that I learned that I'm excited about, I just want to share with everybody. So this is definitely a topic that I am very passionate about. So I have some slides. We're going to go with some slides tonight. So let me just share my screen and let's get this going. Slideshow. Okay, so we are starting off, and let me just see if I can, let me just see if I can do one thing. Maybe I have to do that. There we go. Okay. Okay, so we're starting out with this quote. And the reason why we're starting out with this quote is because, like I just said, this is really my driving force behind why I do what I do. And this quote says, most people have no idea how good their body is designed to feel. And I think that's a really incredible thought to think about as we go through this topic. Okay, so do you or your children need oral myofunctional therapy? So what is oral myofunctional therapy? Oral myofunctional therapy is a kind of, you can think about it as like a physical therapy for your mouth and face. And the goal of this therapy is to restore normal function. Okay, so I think that's important to understand that what we're trying to do is we're trying to restore normal function. And when we have normal function, when things are working the way that they're supposed to work, then things can be good and we can feel good in our body and all that. Okay, so before we even talk about break down what oral myofunctional therapy is, really it all comes down to airway. And what's going on with your tongue and your teeth are really just clues. And they tell us that there is a bigger problem. They're kind of like these, they kind of give us clues. Like you could look at someone's tongue, you can look at someone's teeth, and they actually tell a story, which is kind of cool. And full body health really begins with the airway, which I see is spelled wrong, which begins with the mouth and the oral function. We're going to break this down, okay? So what exactly is the airway? Maybe this is your first time ever hearing about the airway. So this is a nice little image of the airway, but look at that, just to make it a little bit more simple. In between those yellow lines, that is the airway. So this is what we're looking at here is someone who is facing, for my screen, it's someone who's facing this way. You can see their nose and you can see their lips. Their lips are together here, but your airway is like this tube at the back of your throat, okay? Now, your airway, you have like two openings of your airway. You have your nose and you have your mouth. And the way I think about it, it's like a letter F. So you have like a tube that goes from your nose that goes into the airway, and you have a tube that goes from your mouth that goes into the airway, okay? Now, imagine if you were drinking a delicious smoothie and like a really thick smoothie, and you're trying to drink this thick smoothie, but somebody gave you a coffee stirrer straw. That would be really, really challenging to drink that smoothie through such a thin straw, okay? The same thing is with our airway. Your airway is where air is coming into your body. Now, if we think about the physical needs that our body has, oxygen is one of the foundational needs that our body has, right? Just the way Hashem designed this world is that our body needs oxygen. The way, when you think about your body needing oxygen, like you have your whole body, but really your body is made up of parts, made up of organs, made up of tons of tiny cells. Every single cell in your body needs oxygen in order to function. So if your airway is really thin, very narrow, then it's like you're trying to get in the right, like the amount of oxygen you need, but instead it's like you're sucking in that oxygen through a little coffee stirrer straw. So over here, this little image over here on the left, it shows us, if you look like right in front of the bottom of his ear, it shows you that's like the back of the airway, and it shows you that's what normal airflow is going to look like. It's right behind the tongue. And then if you go to the right, this person over here has a very, very narrow airway. Okay, that means that the oxygen coming into his body is going to be limited. So we have on the left, we have what we call normal airflow, and on the right is what we have limited airflow. Now, why is this a problem? Why should we even care about this? Like, I've never heard about this. What does this even mean? Well, here's the thing. Poor airway health can really be the reason behind a lot of conditions, like sleep issues, such as snoring or sleep apnea. If you are, maybe you don't think you have a sleep issue, but you just wake up not feeling rested, or you're just tired all the time. Those are things that are actually could be connected to your airway health, excess weight gain, headaches. If you have somebody who like just deals with headaches and you've tried lots of different things and you're like, I don't know what's going on. Here's a crazy thing, behavioral issues in children and even adults, ADHD symptoms are connected to airway health, even emotional regulation and anxiety, just to name a few. Okay, so we're going to be going through more things, but I wanted to give you just an overall idea of, as we're going through this, like what are some of the things that our airway is connected to? Because again, like when I first learned about this, this was like really, I had no idea that these things were connected. And we'll talk about this a little bit more again as we go on. Okay, so these are things that have to do with airway health. Now, myofunctional therapy is again, it's a physical therapy that we do to help with the structures of the tongue and the face to help us to restore normal function so that we can have an airway, so we can function properly. So if you look back here in this one for a second, if you look at the back of the tongue of either of these people, but if you look at the back of the tongue is the wall of the airway. So when the tongue, actually you can see the person on the left, their tongue is actually where it's supposed to be, which is what we'll talk about, which is up on the roof of the mouth, which opens up the airway, versus the person on the right, their tongue is actually low. And you see that when the person's tongue is low, the back of the tongue goes into the airway, and it's the back of the tongue that goes into the airway that's one of the things that could be contributing to a narrow airway. So what we're trying to do with myofunctional therapy is we're trying to get the tongue back to where it belongs so that it can open up the airway, so that if we have any of these issues that are connected to airway, it can be alleviated and it can be helped. So myofunctional therapy can be broken down very simply into 4 goals of myofunctional therapy. And when I do myofunctional therapy with clients, we are always going back down to these 4 goals that we're about to talk about. And if all these 4 goals that we're about to talk about are accomplished, you will have proper dental and craniofacial development in children. Okay, we're going to talk about that in a moment because that is also mind-blowing. Okay, so the 4 goals of myofunctional therapy: nasal breathing all day and all night. Together with that, you'll see all these goals, they flow one into the other. The next goal is lip seal, because anytime some people will say, well, I'm not a mouth breather, but if your mouth is open, you are automatically breathing from your mouth. So unless your mouth is closed, you are mouth breathing. So together with getting that nasal breathing all day and all night, we want lip seal all day and all night, unless when you're talking or eating. The third goal is tongue posture, that we want the tongue to be, and we'll talk about it a little bit later, we want the tongue to be resting up on the roof of the mouth, which is where it belongs. And that should be all day and all night, because again, when that tongue is up, it opens up the back of the airway. And then the fourth goal is swallowing all day and all night. So these goals, we start out with them as we work on exercises to help build the skills that we need in order to make these habitual. So this is where like it's not just about like the exercises that you do, but it's about changing how you're using your body throughout the day, which if you've come to my Restore Your Core, my prenatal class, you know that we talk about that how you use your body throughout the day makes a big difference. So here's the craziest thing, and there should be some slides coming up on this, that the way that a child's face grows will change depending on whether they have this function going on or not, which I think is just mind-blowing to me, because I always thought that, like, you have genetics and you just look the way you look because of your parents and because of what you are. But you actually can change the way that the shape of your face based on these things, based on what your lips are doing, based on what your tongue is doing, based on if you're nasal breathing or not. And again, we should talk about it a little bit more. So this kid over here, this kid, I don't know if you guys can see, but see, he has what we call open mouth posture. His mouth is kind of like always open. You can start seeing that he has crowding in his teeth already at this age. And you can see by his eyes, they kind of look a little bit like tired, a little bit glassy. And really, unfortunately, this is a kid who is not getting enough oxygen. And if you just think about, like I think about, like a little kid's brain is growing so exponentially. And if they're growing without the proper oxygen they need, like, I don't know, to me, that's a very, very sad thought. Okay, so what happens when we don't have these goals? When we don't have these goals, we default to mouth breathing, which is going to lead to a low tongue posture. It's very challenging to have your tongue open, to have your mouth open and your tongue up. And your lips will be apart. And this is not the way our body was designed to be used. And when we have that, when we are defaulting to like this mouth breathing, low tongue posture, lips apart, unfortunately, a lot of times, most of the time, all of the time, I don't like being like a negative person, but like most of the time it will end up leading to bigger problems down the road. What happens is sometimes, like, I have a very unique position because I work mostly with adults, older kids and adults. And sometimes maybe when they're kids, they seem fine and you're like, I don't really see any issues. But, I'm working with the people who are 30, 40, 50, 60 and have been dealing with lots of unpleasant things. Then Baruch Hashem, we can get them some help. But yeah, so sometimes usually these are the type of things that, like, it kind of gets worse as you go on. And this is a very interesting thing because, like, what do we do if we have crooked teeth? We do braces. If someone has sleep apnea, they might use a CPAP machine. There's other interventions for different things. And those are all super important. And I'm a big believer in all of those things. And those interventions are not really treating the root cause. So, for example, if any person who has ever or will ever need braces, they need braces because they have oral myodysfunction. They have dysfunction, right? I don't know exactly how to say that, but they have dysfunction going on. And if you don't address the dysfunction, then what's going to happen is, like, I don't know if it's either happened to you or a lot of people who, like, it's very common for people who've had braces to have what we call orthodontic relapse, that they'll have braces and then, it could be years later, but their teeth will go back to where it was. And, there's people who will just keep having braces over and over because they're not really dealing with the root cause. So what are some problems that will come up if we have oral dysfunction? And let's see. So if you're a baby with oral dysfunction, there could be nursing issues. There could be colic. Colic is like the doctor's way of saying your baby is upset and we don't know why. So we're going to call it colic and send you home. Reflux, which I think is fascinating. So many babies who are diagnosed with reflux and are given medication for the reflux, when really in reality there's oral dysfunction that's going on. If baby is not gaining weight or they're having eating issues, that is all connected to oral function. Chronic ear infections can happen. Picky eating, which again, all this was like mind blowing when I learned it, because honestly, like, I had my kid Baruch Hashem, he is not a picky eater anymore, but I always sort of just thought, like, they're sort of just being obnoxious. Like, why are they being a picky eater? Just, like, eat the food. Come on, what's the big deal? And what I learned was that, like a kid can't say, or even an adult might not have the vocabulary. They don't have the vocabulary to say, when I put that texture or that food in my mouth, because of my oral dysfunction, it's so tiring and it's so uncomfortable to eat it. So I'm just going to avoid it, right? No one has that language. They're just like, ugh, I don't like that, right? But a lot of times, why is someone not eating a food? It's because it's uncomfortable for them to eat it. Like we talked about, poor facial growth and development. I think I have a picture. Well, I'll see if we have a picture coming up. But if you think about, if someone is spending a lot of time with their mouth open, they're actually growing in a way where they're growing down. Whereas, and you'll see people who have very like long faces, versus we are designed to grow forward. And when you're growing and your lips are together and your tongue is up, you will grow more forward versus growing more down. Speech issues could be connected. Dental problems, like there's orthodontic issues like crowded teeth, but also cavities. If somebody is chronically a mouth breather, they are bringing in all this air that is not being filtered. Our nose has a filter. Our mouth does not have a filter. So if air is coming in through your mouth, it's going to, that could be a cause of a lot of cavities. And it's actually really fascinating because one of my kids, I had like one kid who just like every time we went to the dentist, he was getting cavities. And I'm like, we have like, we're all eating the same thing. We're all living in the same house. Why is one kid consistently getting cavities? And we worked on his, and I didn't realize at the time because I didn't know to look out for it, but he was definitely a chronic mouth breather. His mouth was always open. He slept with his mouth open, and we addressed that, and he stopped getting cavities, which I thought was amazing, and sleep issues. So here's the thing. When we see someone sleeping, like, in my head, it's like you're either sleeping or you're not, right? Like that's how we kind of look at it. Like if someone's laying down and their eyes are closed, we're like, oh, they're sleeping. But there's actually like variations in the quality of sleep that someone's getting. So if we had better language for it, it would be like, oh, that she's sleeping, but she's getting restorative sleep. She's sleeping, but she's getting semi-restorative sleep. She's sleeping, but she's not getting restorative sleep. And one of the things that decide if you're getting restorative sleep or not is what's happening in your airway, which I just think is amazing and fascinating. So the way I think about it is like, if somebody has a compromised airway, and like when you plug your phone in at night, you expect that when you wake up in the morning, it's going to be charged to 100%, right? But what if like something was wrong with your charger and you plugged your phone in and it was only like, it could only ever get to like 65% or like 35%, right? And that's what happens to some of us when we're sleeping, that we go to sleep and we think, I'm using a charger that should work, but really there's some like faulty hardware that's going on, and you wake up in the morning and we don't realize it because, again, we don't have the vocabulary to know that things could be different, or this is just how I've always been. But really now you're functioning, you're starting your day off at 65% or 45% or 35%, right? Waking up with a dry mouth. Somebody, if you've dealt with dry mouth, that's very obnoxious and annoying, and that's connected. TMJ, if you're somebody who has any sort of jaw pain is also connected to your oral function. Headaches, emotional regulation, and ADHD symptoms. So they're finally starting to come out with this idea that every single kid who is being diagnosed with ADHD should also be getting an airway screening to see what's going on with their airway. Because if you like, imagine if you are a kid and you are only getting plugged into 35% every night, like, yeah, you're going to end up with ADHD symptoms, because it's very hard to show up in the world when you're just like at this, almost like a compromised, you're starting off at this like compromised place. Digestive issues. We said reflux before in babies. Adults can also have reflux. Big kids can have reflux. Digestive issues, any sort of digestive issues, are also connected because your digestive system starts in your mouth. And you know, as a pelvic floor specialist, I've studied the digestive system in great detail, and when you break down the digestive system, it really just starts in your mouth. So if your mouth is not doing what it's supposed to do, it just affects the whole system going down. And then breathing issues, asthma, allergies, enlarged tonsils, adenoids, stuffy nose. I've worked with people who are like, yep, my nose is stuffy 365 days of the year. It's just always stuffy. Baruch Hashem, we're usually able to do something about it. Or someone who's like, yeah, I have allergies all the time. And then, we work on this stuff and, they're able to eventually wean off of allergy medication or not need as much allergy medication. Okay, so now let's take a closer look at each of these 4 goals. Okay, so we're going to start off with nasal breathing. Okay, so we have mouth breathing versus nose breathing. Okay, now you can go Google this and you can go down a whole rabbit hole of all the differences, the benefits of mouth breathing, the benefits of nasal breathing versus mouth breathing. But when we mouth breathe, so one of the first thing that I like to think about is that your nose is designed to breathe. Your mouth is designed for talking and eating. So because oxygen is so important to our survival, we have a backup. So if something's going on with my nose, Baruch Hashem, I have a backup. I can breathe through my mouth, which is amazing. We want that. But your nose is designed for breathing, and your nose has a filter in it. So that means that all the air that's coming in through your nose is getting filtered. And the way that I like to think about it, which is a little bit gross, but when you look at the air around you, it's see-through, right? It's clear, right? You can't see it, but under a microscope, you would see that in the air, there's floating all this stuff, all these like little bugs and these like pieces of your skin and gross, I don't know, lots of gross, disgusting stuff is flying through the air, and your nose is a filter. So your nose is able to filter that out. When the stuff is coming in from your mouth, it's just coming straight into your body, and now your body has to process it and deal with all this gunk that's coming in. Not only is your nose a filter, but it also, the amount of air that you bring in is different. The volume that you bring in through your nose and what you bring in through your mouth is different. And we're not going to go into so much right now, but that volume makes a difference. Like the amount of air that's coming in through your nose is the amount that your body is designed to have, and more is not always better. So when we're like gulping in air, it's not so great for us. And then your nose is also, it warms the air. So now your body doesn't have to work as hard to like take in what's going on from the air. So you see here, mouth breathing will lead to frequent cavities, bad breath, whereas nasal breathing will lead to a healthy oral microbiome. Mouth breathing will lead to snoring and poor sleep quality. So sleep there's like a spectrum. So people have heard of sleep apnea, and sleep apnea is, when people think of sleep apnea, it's like the most extreme situation of what we call a sleep disordered breathing, where somebody will like literally stop breathing, and they'll be like gasping for air, right? And a lot of people have heard about that, and they kind of know it's really bad. But what we don't always realize is that there's actually a spectrum for sleep, and it starts off with, so one second, there's a spectrum of what we call sleep disordered breathing, and sleep apnea is all the way at the end. That's like, yeah, the end, the bad case scenario. But really it starts out with mouth breathing, noisy breathing, snoring is all considered a sleep disordered breathing. And then we have something called UARS, and then that goes into sleep apnea. So just because somebody doesn't qualify for the insurance diagnosis of sleep apnea doesn't necessarily mean that they're getting good quality sleep. Okay, so when we nasal breathe, we get quiet, restful sleep. Mouth breathing can lead to cold and allergies and sinus and congestion, and nose breathing leads to improved immunity and healthier throat and clearer sinuses, because we have those advantages of the nose that are helping us. And we talked about this. Okay, so quality sleep looks like, because I think some of us don't even know that quality sleep looks like mouth closed, lips together, quiet nasal breathing, no snoring and no grinding. So you have some people who are like the snorers, then you have some people who are like grinding their teeth at night. So snoring, like if you hear somebody snoring or you are snoring, know that your body is crying out for oxygen. It's like a very extreme way to think about it. That's the way I think about it, is like if you are snoring, you are not getting enough oxygen. And grinding is the same thing. If you are grinding your teeth at night, what's happening is your body grinding is your body's reflex to get more air into your into your body. Sleep is critical for a healthy body. Critical. Like literally, if you want to feel better, you want to improve your health, the number one thing you can do is get more sleep. I am very passionate about sleep. Sleep is going to regulate your brain function. It's going to stabilize your mood. This is the time where your body heals. Like sleep is critical. Your body needs sleep. Like, I'm just going to put a plug because maybe not necessarily is everybody going to do myofunctional therapy or do any of these other things, but guess what? Like a super easy thing that you can do is to go to sleep earlier, which is the number, sleep is like, is just so crucial for your whole body, for your whole body, whole life. So that's one thing. Okay. Now we're going to talk about lip seal. So here's all images of what people can look like if they don't have lip seal. So the lips are just even, sometimes it's like, you could see a kid with like, their mouth is really wide open, but sometimes, especially for adults, it'll just be like that little bit apart. And again, know that anytime your lips are apart, you are automatically breathing from your mouth. Okay. So what we're looking for is we're looking for having our lips completely lips together. That's how I think about it, is lips together. You want to feel your lips together. Okay, now we're going to talk about tongue posture. So this picture on the left, you see this like red image, that's the tongue. And this is an image of somebody with a low tongue. And then on the right is somebody with a high tongue posture. And it's so funny because like, it's like the tongue is funny. It's like, why do we even ever think about this? And why is this important? And it's like deep in my mouth and who even cares? So it's just incredible how something as simple as that can really make a difference to all these things that we've been talking about. But your tongue actually belongs up on the roof of your mouth. And when we say up on the roof of your mouth, what our goal is with myofunctional therapy is to get the tongue resting on the roof of the mouth. Because if you haven't done it before, or you don't have what we call resting tone in your muscles, it's going to be a very hard work to keep your tongue up. And that's not what we're looking for. We're not looking for hard work all day long to keep your tongue up. That's not good. That's what we call like taking a not great healthy pattern and adding on another not great healthy pattern on it. So ideally what we want is that the default is the tongue up. And that's really what we do with myofunctional therapy. There's some people who they're like, oh, I learned about tongue posture and I just started keeping my tongue up and I'm fine. And there's a lot of people who are like, I started keeping my tongue up and now I've exacerbated all these symptoms and now I have jaw pain and now I have this pain and that pain, because really that's what we do in myofunctional therapy, is like the step-by-step process to help get you there. So, okay, so that's just shown. Okay, so this is a really great image. I like to think about if this is the person's top jaw, so you're kind of like looking at them from the top, and this is the tongue. See how the tongue is filling up the whole entire space. I like to think about it, and when I work with kids, I tell them that the roof of the mouth is the parking spot for the tongue, that's where the tongue belongs. So here's where we get, this is a really great image of how tongue posture starts affecting your dentition, your arches. Okay, so this high tongue posture on the left, you see how like this person's top arch is nice and wide, and then this person on the right, their teeth, their arch is more narrow, their teeth are now crooked, they're going on top of each other. Because here's the thing, let me just see if it's on, let me just see, no, okay. Because your tongue is a muscle that's very strong. Your cheeks are a muscle that's very strong. When you have your tongue, your bones, your teeth are not very strong. They just kind of, they just follow whatever the muscles around it are doing. When our tongue is up on the roof of our mouth and it fills up that whole space, it's like nature's retainer, and it keeps the jaw wide. So imagine that your tongue, even though it doesn't feel like it's a strong muscle, but it is. And when the tongue is up, it's gently but consistently pushing pushing onto the teeth to push them out into this wide position. When the tongue is down, there's nothing there that's holding the teeth in, and the teeth are going to start getting narrow. So if you see, if you or one of your kids or someone you know looks like the person on the right, we already know that this is somebody who has oral dysfunction, and they probably are going to, besides for what's happening in their teeth, they're probably, besides the fact that you'd look at this person and be like, oh, they need braces, they're probably also going to come along with a whole long list of other things that they're dealing with that, again, they probably wouldn't have connected the dots to say like, oh, this is an airway thing. But now that we know what airway things are, we can see. The other thing that I think is very interesting is if you think about the way that the anatomy of the face, the roof of your mouth is the floor of your nose. Okay, I'm gonna say that one more time. The roof of your mouth is the floor of your nose. So if you have a nice wide palate, then your nose is gonna have space. And when your palate is like crowded and narrow, that means that the space that you have to breathe in is also narrow. And just like remember back to the time when the last time you were sick and you couldn't breathe through your nose, it's super, super uncomfortable. And for people who are dealing with a narrow palate, they're just dealing with that like all day long. Okay, so let's just do like a little exercise. Where is your tongue right now? And without changing anything, because we all want to jump to changing things, but really we can only change things that our brain is aware of. So on the right, I have these 3 little dots because we have what's called the spot, which is if you say the word na, 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 or la, 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 if you're saying it correctly, then your tongue is going to touch the roof of your mouth right behind your teeth. And in myofunctional therapy, we call that the spot. That's where the tip of the tongue belongs. And then the middle of the tongue belongs where that middle dot is. And then the back of your tongue belongs where that bottom dot is. So you can kind of like do a little bit of an assessment. Where's the tip of my tongue? Where's the middle of my tongue? Where's the back of my tongue? Is it touching my teeth? Is it at the top? Is it floating? Is it at the bottom? And you can see where is my tongue now versus where it's supposed to be. Okay, and then functional swallow pattern. My favorite is that swallowing becomes the exercises. So, we do this whole long myofunctional therapy program, but then swallowing becomes the exercises. And we swallow all day long. We're swallowing 1,600 to 2,000 times per day. And every time we swallow, that can be supporting our oral function or unfortunately not. When you swallow, you have the force of approximately 20 pounds of pressure on your teeth. That's a lot of pressure on your teeth. Okay, so now we're going to go into my favorite part of this workshop, because what I think is important is for us to be able to know, okay, how do I know if I have airway issues, if I need myofunctional therapy? So what we're going to do in the next little bit is we're going to go through, starting from an infant to a baby to a toddler to a kid/adult, of all the things that someone could be dealing with that are actually connected to airway. Okay. So we have here starting with an infant. So if you have an infant or you know of an infant that is dealing with any of these things could be very much connected to oral dysfunction. And if I hear of a infant who's dealing with any of these things, my first thought is, have they gotten a very thorough oral assessment by somebody who is trained in oral function for an infant? So if there's any nursing issues, like a painful latch, clogged ducts, mastitis, clicking during nursing, milk leaking from the mouth, losing milk, all oral dysfunction. If a baby is dealing with reflux, colic, if your baby hates tummy time, babies don't love tummy time, but if they're like, I can never get, like if I put them in there for a second, they're screaming, that's not a good sign. Because if you think about it, if in order to, when your baby is on their tummy, they have to lift up like this. And if there's a tongue tie, which we're going to talk about tongue tie soon, or oral dysfunction, it could be pulling on it and it'll just make it uncomfortable. So again, a baby is not going to be like, hey mom, that restriction in my tongue makes it super uncomfortable for me to be on my tummy. Can you please take care of it? They're just going to be like, wah, 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 right? So babies are smart. If they're hating tummy time, then that could be a reason. And this is just another plug for tummy time. Like, one of the best things you can do with your infant for as long and as often during the day as you can. If your baby is mouth breathing consistently, we're not talking about like here or there, everyone mouth breathes here or there, but we're talking about like a baby who is consistently mouth breathing day and night. That's an issue. Noisy breathing at night or snoring. We have little babies who, I mean, it's like, oh, it's so cute, they're snoring, but actually, no, it's not cute. And it means that they're not getting enough air. Okay, then we have if they're going to a baby stage. If you have any feeding issues with your baby, if they're a picky eater, if they're not gaining weight, if they're not eating certain textures, and again, if they're a mouth breather day or night, if they're noisy breathing night or snoring, those are all things that you want to look for. You want to be like, oh, wait, I know this could be an oral issue and let me get it checked out. Okay, so child, and just know like we're going in the order of age from youngest to oldest, and just know that it's like, and everything before it like, goes, okay, so crowded teeth. So baby teeth need space in between them. Baby teeth are smaller than adult teeth, so you want that when the baby teeth come out, there's space for the adult teeth to come in. So if you see a kid and they have crowded teeth, you don't have to wait till their adult teeth come in. You don't have to wait for their baby teeth to come out. You could right away be like, 1 second, my child has crowded teeth. I already know that they're not going to have enough space in their jaw, and what can we do about it? If you have a child that is getting a lot of cavities, again, this could be an airway thing. If you have a kid who has ADHD symptoms, emotional regulation issues, this could be an airway issue. You want to know, do they have any of the other stuff? Are they mouth breathing? Are they stuffy? Are they, how are they sleeping at night? If they're a picky eater, if they're bedwetting, which again is fascinating because there's so many kids that deal with bedwetting well past the age of when we would expect. And there's like, oh, we don't know what's going on and we don't know how to deal with it. And really a lot of times, if a kid is not getting the quality sleep that they need, it will result in bedwetting. And when we can address the airway issues and the oral dysfunction, then the bedwetting will be addressed also. Any sleep issues like having a hard time falling asleep, waking up many times in the night, mouth breathing, audible breathing, or snoring are all signs that your kid has a oral dysfunction. Breathing issues, chronic stuffy nose, asthma, allergies. These are, again, all these things. Digestive issues, if you have a kid with reflux or just in general, like a lot of digestive issues. And then orthodontic issues, crooked teeth, overbite. 100% you know that any kid who needs braces also has oral dysfunction. And now older kids and adults. So everything that we said with a younger kid, if you were like, oh, that's me, or my kid. Yep, all those things still apply. Plus, as they're getting older, that's when we start seeing things like orthodontic relapse because, now they've had braces. TMJ, you don't necessarily see TMJ in little kids, but you will see it as people get older. Chronic headaches and any sleep issues or not waking up rested. These are all like, they should flag to you, okay, maybe I need myofunctional therapy. Okay, now we haven't talked about tongue ties yet because it's really, really important to understand like their Baruch Hashem, tongue ties are becoming a lot more known, and that's a really good thing. And sometimes when that happens, or I guess one of the things that has happened because of that is people get very fixated on tongue tie. Do I have a tongue tie? Do I not have a tongue tie? Let me get my tongue tie fixed and released is how I like to the term I like to use. But here's the thing. A tongue tie is only an issue because it gets in the way of normal function. Like a tongue tie, and the reason why I want you to think about it that way is because the goal is not release the tongue tie. The goal is reestablish normal function. What reestablished normal function is going to look different if you are an infant, a baby, a child, or an adult. But the reason why tongue ties are an issue, first of all, if you don't know what a tongue tie is, our tongue is connected to the bottom of our mouth. And sometimes our tongue can be overly connected to the bottom of our mouth. And when our tongue is overly connected, that will lead to low tongue posture, which will lead to open mouth, which will lead to not having proper posture, which will lead to not having swallowing patterns. So usually somebody who has a tongue tie will end up with all not being able to meet those goals of myofunctional therapy with the tongue tie. But we want to we're trying to regain normal function. We're not just trying to release tongue ties. sometimes in order to get to normal function, you need to release a tongue tie. And that's the context. So the context is really, really important. Like I like to say that tongue ties fixes the anatomy, but it doesn't fix the function. So meaning if, let's say I was born, and even everybody around me was born with my arm like attached to my lower arm was attached to my upper arm like this, and then someone was like, oh hey Henna, do you know that that's not so normal and there's a procedure you could do to get rid of it? And I'd be like, oh okay, great, let me go do that. And they would release this. These muscles, my arm would have no idea what to do with itself, and it would need some sort of physical therapy to learn what to do, right? And that's kind of what happens with the tongue tie. The tongue tie release will just release it, but we want to be able to teach it what to do. Okay, so this picture is, there's really like 3 parts that go together. We have what we call the tongue tone, the tongue tie, and the tongue space. And this is just going to give you a little bit of a broader picture of where myofunctional therapy falls into airway health, because these are the 3 things that contribute to airway health. So tongue tone we address tongue tone by oral myofunctional therapy. So if your tongue is not strong enough to do what it's supposed to do, it's not coordinated, that's what oral myofunctional therapy is about. If you have a tongue tie, you will need a tongue tie release to address it. And then sometimes your tongue will not have enough space in your palate, depending on how old you are and what's been going on. Like if you've been growing and your tongue was low, you might not have enough space in that upper arch. And the way that we get space in the upper arch will be to do something called palatal expansion. A lot of people who have had braces, a lot of times, hopefully if they're a good orthodontist, they will do expansion before. There's so many different expansion options. If you've had an expander, it's like it has a key and you like have to turn it every day or every other day, whatever it is. And there's different options for palatal expansion depending on the age, and that's a whole other situation. Okay, just to kind of again bring tongue ties into the broader context, is that a successful tongue tie is more than just releasing the tongue tie. So here's like a lot of times what will happen is someone will go to their pediatrician or go to a local ENT who will just clip the tongue tie and be like, okay, I did it. But then the person doesn't get the results that they want. And then they blame it on the tongue tie. And they're like, well, I did the tongue tie, but why didn't see the results? So must be something wrong with tongue ties, with getting a tongue tie release. Whereas we can say, 1 second, do you have all the components for a successful tongue tie release? Somebody who uses the term clip tongue ties most likely is not somebody who is an expert in tongue ties. So right off the bat, if somebody's offering just we could just clip your tongue tie right here and there, right in this moment, you can just know that it's going to be helpful somewhat. There's something is always better than nothing, but you're not necessarily dealing with an expert. And we'll talk about that in a moment. But so a successful tongue tie release looks like a combination of myofunctional therapy. This would be for an adult. We'll talk about babies in a moment, but oral myofunctional therapy to regain the strength. And we do myofunctional therapy before the release and after the release. Usually adults and babies need some sort of body work, like when your body has been dealing with your mouth that's not working properly and a lot of tension, you probably need some extra outside help. And then we get the tongue tie release. And it's these 3 things together. Now, when we're talking about infants, we're looking at a tongue tie release, body work. And especially if your baby is nursing, they won't need myofunctional therapy. But what you would want to do is would want to go to a feeding specialist / IBCLC who is an expert in retraining babies how to nurse, because there's something, the way I like to call it is there's passive nursing and there's active nursing. And a baby could just be like passively just getting the milk, or a baby could be milking the breast. And what we want is a baby that milks the breast and is actually using their whole tongue properly. And a baby will need to be taught that, because here's the craziest thing. Babies are sucking starting in utero at 3 months. So 3 months pregnant. So that means that when your baby is born, your baby has already had a sucking pattern for 6 months. which is just wild. To me, that's wild because it's like, you think like, I'm getting this brand new baby that just is like, you know, just starting a fresh start. But like that baby has been already living inside you and has already been sucking since 3 months, So it makes sense that now this baby needs to be taught, how can we nurse in an active way? Okay. Okay. So, and then the other thing that I want to say about tongue ties is that tongue ties are a relatively, newer field in terms of research. Okay, so the way that the medical field works is that in order for something to be widely accepted, there needs to be research that fits a lot of parameters, and they get the research, and then the statistics are that it takes about, from when something is researched, like a study is researched, is published, it takes about 20 years from the study to implementation. That is a really, really long time. So what that tells us is that, first of all, there have been doctors who have been doing tongue tie releases for years and years and years before there was official research, and they have a lot of clinical experience to tell you. They will say, I've worked with this many people and this is the results I get. Now, in the medical field, that's not very, they just don't accept that. So even though you can be like, the doctor can be like, I've seen thousands and thousands of patients and this is the results that I get, the medical field doesn't accept that. So what the medical field accepts is studies, and the earliest study that we have on myofunctional therapy is from 2008. So we're almost there for 20 years. And the research is coming out slower and slower. I mean, more and more. It started off slow. There's more and more research. But if you're wondering, like, why doesn't my doctor know about this? Or why doesn't my ENT know about this? Or even why doesn't my lactation consultant know about this? Because the people who are learning about tongue ties are people who are choosing to invest in higher education in order to be on the up and up on what's coming out. Because even, you know, when I first studied myofunctional therapy 4 or 5 years ago, 4 or 5 years ago, I mean, things have changed and more research has come out. And if you're not on top of the research, then you're not hearing about it. So if someone is like, I always want to know from somebody, like, when was the last time you attended a conference on tongue ties? When was the last time you took a course on tongue ties? Because if you are relying on information we have from 20 years ago, 30 years ago, when you were in whatever training you took, then you're just not up to date. And the people that are up to date are people who it's a smaller group of people who are really invested in and interested in learning about this. So that's just something to keep in mind, that it's not everybody is going to know about this. Okay, so in case you're wondering, what is the commitment for myofunctional therapy? Like, what does myofunctional therapy look like? So myofunctional therapy looks like a combination of, it's usually 9 to 12 sessions to complete the 4 goals. So the way that I do myofunctional therapy is we are always coming back to those 4 goals. And those are the 4 goals that we're trying to achieve. And that usually takes between 9 to 12 sessions. It's a combination of active exercises, which are 10 minutes per day. But active exercises are like, you are not doing anything else. You are sitting in front of a mirror. You are focusing on the exercises. You are making sure you're doing them properly. Plus passive exercises, which you can do anytime. And then it's a combination of awareness. And the success of the myofunctional therapy depends on all of these 3 things. So now that we're at the end here, you can ask yourself, do you or your children need oral myofunctional therapy? And based on everything that we have talked about, you have a lot more knowledge to be able to go back and say, 1 second, am I dealing with some oral dysfunction? Is one of my children dealing with oral dysfunction? And is this maybe the next step that we can take to help them? Next steps, you can always get in touch with me. You can get in touch with me if you have any questions. You can also book an evaluation, and we can do an evaluation and we can see what's going on with you. If you have any questions, you can always reach out to me. Here's my phone number, 310-279-3315. And you can email me, henna@hennashomer.com, or you can also just reach me through my website. But if you just want to hear more or you have any questions, I am here for you. And I think That is it. This, I don't know if this is going to gross people out, but this is super interesting. I put it at the end in case it's going to gross somebody out. This is what we call the deep front line. And we have these, we call them fascial trains in our body. And if we want to understand, like, how could tongue ties be connected to all these things? This is one train in your body. It goes, the top here is the tongue. It goes through your lung, goes through your diaphragm, your breathing muscle, through your psoas. If you've been in my classes, you know what the psoas is. Goes through your knees, through the back of your legs, and all the way down to your toes, which I just think is incredible that it's one long chain. So there's some people who will get a tongue tie release and they'll be like, oh my gosh, I've had all this tension and I don't feel it anymore. So that's, if you're interested, you can look more on that. It's called the deep front line. Okay, so I'm going to stop sharing my screen. Oh my gosh, look at me. That's great timing. I usually go way over. Okay, so that's the end, but now I'm gonna look and see. Michal, are people able to, like, if they have questions, can they unmute themselves? What do you do? They put it in the chat, you're gonna read them? What do you want to do?
Right now we have the chat, but if you'd
Okay.
like, I can let them, whatever, what do you feel? What would
Well,
you
are
rather?
there any, before I start looking through the chat, because I get very distracted, are there any questions there that you think that I should start off with addressing?
Okay, so how about this? I'll field the questions and I'll post them. Does that sound good?
Yeah, great.
Okay, this was more of a comment, but I wanted to actually hear your thoughts. When you mentioned reflux, who says an ENT, one of the top ones in the area, actually said my baby's constant congestion was because of reflux. Interesting to hear the opposite perspective. Do you have any thoughts on that? Which one comes first, which one comes second, or how? You can say pass also.
I mean, which one comes first, which one comes second? I mean, I think that the human body is complicated and there are going to be lots of different perspectives. What did you say that the congestion came from the reflux?
Congestion was because of the reflux.
Oh, so for me, I guess the way that I would think about it is that either way, it doesn't really matter. Now that I know that reflux is connected, reflux and congestion are connected to oral function, my first thing, if it's a baby, I would say, like, let's go to somebody who specializes in working with babies in oral function, and see how that goes. Like, I think it's important to understand the role of doctors, that the role of a doctor, this is the way that I sometimes have a funny way of thinking about things, but it like makes it very, like, I bring it down to like a very clear level, but like doctors have very, very important jobs, and their very important job is to keep us alive. And the doctor is going to, their job is like, are you sick? Are you healthy? Like, you're not sick? Okay, great. You can go. The function of, like, how am I function? How am I feeling? Am I functioning optimally? It's just not even in their job description. It's not like they're not doing something that they're supposed to be doing. It's like the amount of, they go through so much schooling, and it's so important that they keep us alive. And we can't also expect them to think about function. So again, like your regular ENT, I don't know, he could be a very top ENT, but again, his job is not going to be to study infant oral function. You know, that's just not their job. So yeah, so either which way, I don't know if I would, I don't think for me personally, it would like make a difference, like which came first or which came second. I would just be like, oh, my child is dealing with this. Let's just see if there is something that we can do from the functional perspective.
Amazing. Okay. The next one. Hi, Henna. Do you know any of these professionals who can work with children in the New York City area?
Okay, so it depends what professional you need. There is, like, if you're looking for, yeah, like there are lots of professionals that might be on board for the team, for the airway team. So someone might need a myofunctional therapist, they might need an orthodontist, they might need an ENT. So it would depend on what they need, but there are resources. One resource is the Breathe Institute in LA. There's like 2 doctors that are at the top of the field that are like pushing the field and pushing the research. in tongue ties. One is in LA. His name is Dr. Zaghi from the Breathe Institute. And the other one is Dr. Richard Baxter from Alabama Tongue Tie Center. So those are two people that I would like see if they have, I know the Breathe Institute does have some affiliates, but Dina Izagui is also in Crown Heights. If you're someone in Crown Heights and you're looking for a myofunctional therapist, Dina is really, really amazing. So she's somebody that I recommend. But if you're looking for more specifics, you could let me know and we can see what we have in our network.
Beautiful. And the follow-up question to that was, do these myofunctional therapists usually take insurance?
No, they don't take insurance. They don't take insurance. In my opinion, I think that like the way that I look at myofunctional therapy is kind of like is going to go in the path of OT, occupational therapy. Like 20 years ago, there were no OTs that took insurance, and Baruch Hashem, insurance companies are starting to understand that OT is really, really important. So I think in the future, I think they will, but for right now, there are very, very few. Like every once in a while, you can find like a speech therapist who also does myofunctional therapy. Like there's one that I know about in Florida, but that takes insurance, but most of them don't.
Okay, beautiful. And now the next question is, can this work be done remotely? Is it more effective in person?
Very, very good question. So I think that for older kids and adults, you could definitely do it remotely. I actually like exclusively work remotely, and I have, Baruch Hashem, lots of really, really great results. It has to be somebody who enjoys or is like, okay, like I think virtual work is not for everybody. And I think that's okay if you're like, no, I want to see somebody in person. But for little kids, it's not my go-to, and I definitely would much rather refer out to somebody in person, unless it's like, oh, we don't have anyone nearby and the mother is like super, super committed, then maybe it could work. But for older kids and adults, 100%, mostly we're working on like the myofunctional perspective is we're working on function, and that we can for sure do virtually with a lot of success.
Okay. Is there any general exercise that everyone can do to strengthen their airway through getting a specific evaluation? Oh, without getting a specific evaluation.
Yeah, I mean, the number one thing that hopefully you've gained out of this is like lips together, breathe through your nose. Like the number one thing that you can do is just, if you notice that you're mouth breathing, bring your lips together. If you're noticing that you're very congested, blow your nose, keep your nose clear, do what you need to do to keep your nose clear so that you can breathe through your nose. Like nasal breathing is literally one of the biggest gifts you can give yourself. So even before we jump into any exercises, I think that would be like the number one takeaway is like, keep my lips together, breathe through my nose.
Beautiful. Okay. It's actually funny. It's not on the comments, but I remember somebody making a mention about sleeping with tape or something. Is that?
Yes.
Can you tell us a
Yeah.
bit about this?
Yeah, sure. So we know that if someone is sleeping with their mouth open, they are not getting quality sleep. So for some people, once we work on, so you have like muscles around your lips, this like round muscles. So when we work on those muscles and we work on establishing lip seal during the day, it will automatically carry over into the night. For a lot of people, it doesn't. And what they will do is there's actually special tape that they make that you can put on your lips, and you can sleep with your lips. That will help you to keep your lips closed all night long. Now, normally what I do is we don't like necessarily recommend like first out of the gate, like to start with mouth taping. You want to make sure that you are comfortable nasal breathing. So like with kids and even with adults, we generally recommend trying to see if you can mouth tape during the day for at least 30 minutes. And if you're comfortable with that for 30 minutes during the day, then go ahead and try it at night. But there are a lot of people who don't do myofunctional therapy for whatever reason. And the only thing that they do is they start mouth taping at night so that they can get a nasal, and they can breathe through their nose the whole night. And they see so many benefits. So again, you're using the type of tape you're using is it's very like it's tape that's very, it's not very sticky. It's designed for skin, and like you put it on, and if you open your mouth on purpose, you should be able to open it. Like, we're not talking about duct tape. Don't like take random tape from your house and like, you know, but there is, and then they even have like, now you can go, they have so many products of like tape that goes around if you're not comfortable with the tape on the mouth, or, you know, there's tape on the mouth that has like little dots on it. So like, there's lots of products if the whole idea of mouth tape feels uncomfortable. So again, I would not just like start taping my kid's mouth. For me, if I was an adult, I would again want to make sure that I'm comfortable with having my mouth, my lips closed, and want to make sure that you're going to sleep with your nose clear. So I know it's like, it sounds really basic, but we call it nasal hygiene, just like you have oral hygiene. You wake up in the morning, you blow your nose, you go to sleep at night. Before you go to sleep at night, you blow your nose. Even if you don't feel like you need it, you can usually just get a little bit more clearing. So you definitely want to set yourself up for success. Make sure I can breathe through my nose. But yeah, I had a client, a Restore Core client, who was telling me that she was always a nasal breather. She used to sleep all the time with her mouth closed, and something happened over her pregnancy that she sort of like defaulted to mouth breathing. And then she was post baby, and she was taking care of a newborn, and she was mouth breathing, and she was super tired, and she started mouth taping. And she's like, it made such a big difference. Like, yes, I'm still waking up with a newborn, but now I'm not that like additional level of exhaustion from sleeping with my mouth open the whole night. So that's the idea behind mouth tape at night.
Got it. Thank you. Thank you for sharing that. How do you do nasal breathing if your nose is completely blocked because of allergies?
Yeah. So if your nose is completely blocked because of allergies, then we want to back up a little bit and see, number one, we want to do some consistent nasal hygiene. There are lots of different things out there that you can use to clear your nose, like saline and I forgot what it's called, neti pots and things like that. There's a spray called Xlear spray, which is like a xylitol spray. When you do nasal hygiene things regularly, it makes a difference. And here's the thing, the more you nasal breathe, the more you can nasal breathe. So when someone's mouth is open, and you can think about the fact, like, if my mouth is open, I'm breathing in and out from my mouth, there's no airflow going in and out from my nose. And then that air gets very stagnant, and that's gonna reinforce the stuffy nose. So you have to like break the cycle somewhere. And normally what we do, this is a process, like somebody who goes from a chronic mouth breather to a nasal breather usually takes about, I don't know, 5-6 weeks till they start like seeing a difference. But if you're dealing with allergies, so number one, it would be like nasal hygiene and really trying to force yourself. Force is a strong word, but we'll use it for now. Force yourself to breathe from your nose as much as possible, knowing that the more you breathe from your nose, the more you will be able to. So you're not forcing yourself to the point that you're like, I can't breathe, and you pass out. Like, that's not what we're looking for. But what we're looking for is like, I want to default to mouth breathing. Can I force myself a little bit? Can I encourage nasal breathing a little bit? And there's also a nose clearing exercise that we teach that also can help sometimes if your nose is like super stuffy and you've tried everything. So if you're somebody who like, my nose is super stuffy, I've tried all the stuff, it's not working, that would be like that would be a good reason to work with a myofunctional therapist to help get you on the path. Because sometimes it's like super easy, like bring your lips together and you're like, oh, okay, now I can nasal breathe. And sometimes it's a little bit more complicated.
Got it. Okay. The next question is, could braces be avoided with your therapy?
Can braces be avoided? So that's a very, very, very good question. I think that like the theory behind it is yes. So like the theory is yes, braces can be avoided. When you're dealing with growing kids, it's always going to be like, it's never going to be a linear path. So you have to think about like, where is my kid starting from? What's going on with them? What am I dealing with? To be able to say like, to be able to like guarantee if you do this, then this is going to happen is not something that we do in myofunctional therapy. mostly because number one, we're not in charge of results. Like we know, when I say we, I mean humans as opposed to Hashem. We know what science tells us. We know from our clinical experience. We know what happens to most people, but there's zero way for me to know exactly what's going to happen for your specific situation. So the way I look at it, this is the way I look at all of it. If you might have heard me talk about this before, but like my job as a human being on this planet is to take the steps and to make the hishtadlus, and Hashem is in charge of outcomes. So while we know that, oh, most kids who do this end up with this result, like I have no way of knowing exactly what's going to go on in your exact body. So, you know, I have Baruch Hashem, 5 kids that have all been through, you know, their own airway health journey because they have me as a mother, and some of them didn't need braces and some of them are going to need braces. And, you know, it's just, there's different factors that sometimes are beyond our control. So, the answer is like, in theory, yes. But we can't guarantee anything.
Sorry, can you hear me?
Yeah, I could hear you.
Okay, great. Perfect. How is this therapy different than breathing therapy, or is it the same?
So I don't know what breathing therapy is. So I
Okay.
wouldn't know if it's different or if it's the same. So I guess it would depend on what this person is referring to when they talk about breathing therapy. Like there is a lot of breathing that is involved in myofunctional therapy, but I don't know exactly what they're talking about. So I wouldn't be able to know.
Okay. And is post-nasal drip or loud swallowing impacted by this?
Yeah.
Yes.
Yeah, definitely. Yeah.
Okay. How common is it to have oral problems? What causes someone to develop these besides for tongue tie?
Yeah. Yeah, I mean, tongue ties are big because you know, the amount of babies born with tongue ties is very high. You know, there's a lot of like, you know, like a chicken egg situation. Like I'm just thinking about a little boy that I know who, you know, since he was a baby, his nose was always stuffy. And that means that he grew with a stuffy nose with his mouth open, right? And now he's 5 or 6 years old, and now he's dealing with crowded teeth, and he's dealing with huge tonsils, and he's dealing with, you know, a lot other stuff that so it's like, let's say for this kid it would be like, well, maybe his root cause, it started with the congestion, which we don't know. You know, I didn't work with him. Like, I don't know why a baby was born with so much congestion. Could be that there were like allergies going on. It could be, you know, I don't know. So it's hard to know. What was the question again? Why are so many people?
Yeah, how common is it to have oral problems and what causes it?
Oh,
I mean,
yeah,
besides for tongue tie, meaning
right.
I feel like when you come and you list out the symptoms, everyone's like, hello, me,
Yeah,
you know? So it's like, it
yeah,
seems like a lot of people fit under this cause,
yeah.
umbrella.
Yeah, I mean, there's lots of really great resources out there. There's a book called Breathe by James Nestor. That would be a really great book. There's another book I think it's called Jaws. You know, there's different theories of like where all this is coming from and what's going on. And I feel like that's a whole other conversation about like, you know, why is it so common? But yeah, it definitely is very common. Yeah.
There's a mention here. There's a speech therapy place in Stony Brook, New York, who say they do myofunctional therapy with their speech therapy, and they take insurance. It's called Now You're Talking, if that helps
Oh,
anyone. There you
amazing.
go.
Thank you for sharing.
The CST told me to make sure my baby's mouth is closed so that he doesn't become a mouth breather. Is that something that would have solved the airway issue, or is it only a symptom of the pre-existing issue?
I mean, I think that with some babies, first of all, yes, like one of the first things that we can do with babies is if you see a baby with their mouth open, you just gently take your thumb underneath on the soft part underneath their jaw, and you can just gently press. What you're doing, you're essentially is pressing the bottom of their tongue up to the roof of their mouth. And you can hold it there for like a few breath cycles. And for a lot of babies, if you let go, then their mouth will stay closed. I would say like it depends on, you know, I've seen some babies that like they you know, they just need like a little reminder every now and then. And then I've seen some babies that are like, no matter how many times we close their mouth, they're not keeping it closed. And they just keep defaulting to opening. So yeah, for some babies that could definitely be enough. And either which way, that's a great place to start. Never to the point of making yourself crazy. Like when you're a mother and you're dealing with a new baby, like you do your best. And if your baby is mouth breathing, sometimes they will be okay. So this is not like an all or nothing situation that you need to be driving yourself crazy about. But yeah, for some babies, that's enough. And for some babies, like if I was in a situation where, wow, I just keep trying to close this baby's mouth and they're not keeping it closed, that's when I would want to default to, not default, then my next step would be, let's go to somebody who deals with infants and oral function, because to me, that's a sign that there's something more going on if they're not able to keep their mouth closed.
Got it. Okay. There's a few questions that are a bit more personal and specific, so I'm gonna let those people know that they should contact you directly.
Okay.
The next one was, does this have something to do with the tooth pillow?
Oh, yes, yes. Yeah, so Tooth Pillow is a company. So there's something called a guided growth appliance. It basically is like an appliance. It's a removable appliance that kids can wear that kind of looks like a mouth guard that helps. It's called a guided growth appliance because it helps the mouth grow, the jaw grow where it's supposed to. So Tooth Pillow is an online provider for these appliances. Either they're using something called a Healthy Start or a Myo Brace. But what's great about Tooth Pillow is that you can do it virtually. So I think you do an assessment with them. You send them pictures, they send you what you need, you are in touch with them, you can choose if you want to add on myofunctional therapy sessions, and there are definitely people who have had really great results with that. So yeah, this is connected to Tooth Pillow.
Tooth
Yeah.
pillow. Okay. Any specific recommendations for lip tape?
So the one that I like is it's a Nextcare sensitive skin. It's just a roll of tape. In my family, we buy it by the case because we go through a lot. But yeah, I think if you just type in Nextcare sensitive skin tape, I'm just looking it up. You can also Nextcare, yep, sensitive skin low trauma tape. That's the one
Sensitive
that
skin low
that's
trauma tape.
yeah.
Okay.
Yeah, or Nextcare is the brand. Like you can also get like like I buy a case of 12. It's not Nextcare, it's 3M, but it's the same idea. It's just not the brand name. So that's the one I get because it's the cheapest. But if you're like, I do not like the idea of putting tape on my mouth or my kid's mouth, again, you can get there. You can just type in like lip tape for sleeping, and you can see there's lots of really great options. Again, if that whole concept doesn't sit right with you.
Mm-hmm. And then there was an interesting comment here. I've been keeping my tongue at the roof of my mouth since you spoke about it, and have been breathing through my nose since then, but it's a jaw workout. My face is not used to this.
Yes.
Anything you'd like
Yes.
to say to that?
Yeah, exactly. Which I guess is one thing is sometimes when we hear of things that are good for us, we like to just jump in and we're like, oh, I heard that my tongue is supposed to be up. Let me just keep my tongue up all day. But I think it's really important to remember there's something called resting tone of your muscle. So the easiest way for me to think about resting tone is in terms of like newborns. Like if you've seen a baby or a newborn who has low muscle tone, they're like very floppy. Sometimes our tongue can have low resting tone. That means that it's resting strength, and the muscle is very floppy. So what we want to do is we want to slowly strengthen our tongue to get it so it could stay up. So if we're going from my tongue has never been up to now I'm going to try to keep it up all the time, that's going to be a lot in one time. And that's where like the myofunctional therapy exercises help to raise the resting tone so that it just like my tongue naturally wants to go up, because that's really where the tongue naturally wants to be. And again, we want to do things like incrementally. We don't want to do like all or nothing sort of things, because your muscles, you want to build the strength in your muscle to be able to go up to the roof of the mouth, as opposed to just like, I'm going to try to force it to go up there all the time. Because yeah, it is going to be a big workout, and we don't want to injure ourselves by doing too much too soon.
Got it. Makes a lot of sense. There was a question about the if according to your piece, the tongue is meant to be on the top and it widens up. What if the teeth on the bottom are what's squished? How does this affect the relationship?
Yeah. So generally, if the bottom of the teeth are smushed, it's usually because the top of the teeth are smushed, like the top jaw, like the bottom jaw really follows along with the bottom jaw follows the top jaw. So for me, like from a myofunctional therapy perspective, like if I see someone with a crowded bottom, like I don't think I would ever, it would be very, very surprising for me to see somebody with a crowded bottom and their top is like very wide. Like that would just be not something that I would see. So not see very commonly. So if I see someone with a crowded bottom, then I would, they would probably be a good candidate for myofunctional therapy. In the airway focused orthodontic world, there are different, shitas on what to do with the bottom jaw and how to address that. So that would be like, if you want to start working on, like, we call that like the structure, you're changing the structure, that would be an orthodontist, would be someone that would be dealing with that.
Mm-hmm. And does that also include like overbite or?
Yeah.
Uh-huh.
Yeah. Overbite, overjet, any of that stuff is like, it's gonna need orthodontic intervention, and they probably also need some myofunctional intervention.
Mm-hmm. Got it. Okay. I think, there was if somebody asked if you could give us your phone number or a way to contact you for more questions, or there's somebody who
Sure.
said you're hired, how do we book you? So I guess that's a start.
Yeah. You can definitely reach out to me my phone number is 310-279-3315. So you send me a WhatsApp message, or you can email me at hennashomer.com. And you also don't have to hire me to ask me questions. So if you have any questions about any of this stuff, you can definitely always reach out to me, and I'm happy to help in, whatever way I can. So if you just have questions or you're not sure about something, yeah, reach out.
Amazing. Okay, beautiful. Thank you, Henna, so much. We're so lucky to have you on all varying topics. If you go on our YouTube channel or our Spotify, you can hear Henna speak about all kinds of amazing things. And as she said, it's all within the line of helping women live a better life and be healthy. And I think the quote you put at the beginning really says it. We don't, sometimes we take these things for granted. Many of us, I'm sure, before we started this, didn't realize how much of this could be improved, and it's not just the norm because everybody deals with it. So
Yeah.
kol hakavod for all your hard work, and thank you for joining
Yeah.
us.
Thank you so much for having me.
Yay, my pleasure. Thank you everybody for joining, and join us next week, Be'ezus Hashem. It'll be in person in Crown Heights with Zoom edition as well, with Irit Ling on how to birth better and recover better. So, or birth right, recover right. That was the topic. So can't wait to see you guys. Thank you so much. Thank you, Henna. Good night, everybody.